ndeti nga mwasa zemiza musika puno mema bido 25 ndeti nga mwasa zemi mai za pena pasi makasi eza mwa distance na ndao okokende pe bwemo na poto kipete oyo kozonga na babido autrement yo ça les até faut mema mai faut vraiment vivre ça mai até via basi pe na bibo eza pasi makasi eza pasi parce que biso basi faut tosala makasi koleka même misala mibali na biso basala mais malgré ba difficulté na nyonso naza ya kolemba te ndenge nazalaki liboso mais nakanisi eza connecté na MMS ma sœur pe ayaki na hôpital Mario sa wakte biswana ebisike MMS eza bien pona basa te esuma sa zemlingi nyonso nde tokendaka kilo te batrata biso esuninga na mambo ebele po biso kolia bien pene ezalaki te mais parti na komomela ngo sikoyo kolia nde pena eyende sikondi makasi kolia makasi balinga bakoka mposo babe eza important mpona mwasi azemi mpona omela balinga bakosombaka nasa mosala na ndako ya koteka ya misala mike mike nde tikotoka mai na pompe kolamba bamisalaka ya mike mike nde yango nasala bataka tous les temps oteka mpe boteki mike ekoplace ozaki makambo su ya olia
tete aza mwasi na nga tomanda vi na biso mwa kala tosalaka vi na biso koto oyo koto nde topona na biso tofanda kwa soki nazongi ndako maboko pamba tomelana na biso ka mai tolali
biloko koma na zembo ya komi oyo ya boyi me nde ziselonga na pona na nyelo te nyonso oyo ekumelinga na liaka pondu na liaka matembele ndunda esangasalanga teke ntango naolamuka naomona bango nyonso baza wana bana balamuki biso nyonso toza na lisanga salanga mwasi yango ezalaka na mpasi soki nayoki mwasi azosufri bazwaka traitement malamu te oyo bitumba ezali lokola ya biso soki tozosala te tosi tozosunga mabota na biso te mboka ekotambola te nakanisi mokili elingaki ezala malamu soki kimia ezalaki bisika nyonso soki bamama babandaki kokamba mboka mibali bazosala guerre me basi batonga mabota mon ami dodo papa au travail dodo mon ami dodo papa au travail maman la cuisine bébé fait dodo fais dodo mon ami dodo papa au travail maman la cuisine bébé fait dodo
Wow, what a moving video. I can get the story. Now, welcome to the Healthy Mothers, Healthy Babies Consortium's fourth coffee and chai chat of this year. And today we are going to be talking about using implementation science to support the introduction and scale up of multiple micronutrient supplementation. You can learn more about the Healthy Mothers, Healthy Babies Consortium, which is a program hosted by the Micronutrient Forum from our website, hmhbconsortium.org. And in case you missed this video, which has just ended, I know some of us were just joining, you can watch this Women's Voices short film about Makenge from the Democratic Republic of the Congo. It's on our YouTube channel, and on the chat, you can find the link that you can click to watch. And there are also other Women's Voices short films that are also available there, and others as well made by partners. For example, ECF has made some films as well, which are also very informative. I invite you to watch those. So today's chat will deep dive into two recently released resources by the Global Multiple Micronutrient Supplementation in Pregnancy Technical Advisory Group, in short, the MMS tag. And this tag is hosted by the Healthy Mothers, Healthy Babies Consortium to provide evidence-based guidance or technical support to program implementers and colleagues who are helping women out there as far as women's nutrition and maternal nutrition is concerned. So the first document is a resource paper for practitioners, which is titled Using Implementation Science to Support the Introduction and Scale-Up of Multiple Micronutrient Supplementation. The link will be in the chat, and you can click it now or after this coffee and chai chat, and you can download and explore the document. And the second document is actually a frequently asked question for national decision makers and health leaders. It's about introducing and scaling multiple micronutrient supplementation programming, frequently asked questions for decision makers. Every time a health leader, like a minister or a permanent secretary for health, every time you have to talk to them about a new intervention, they have a couple of questions that are key. And we have tried to curate those questions and then provided some answers that we'll talk about today. The MMS tag commissioned these documents to meet demand by stakeholders for more guidance on the use of implementation science, including rigorous implementation research across the phases of MMS programs, introduction and scale-up. You will recall that the guidance for MMS, or the recommendation by WHO for MMS, is to be introduced or given in the context of rigorous research. So this document documents provide the background information that is backing that call. And the document was developed collaboratively by more than 20 contributors and reviewers. It provides a good resource material, but also complements the framework for country MMS scale-up that was set forth by a collaboration of donors, Kirk Humanitarian, the Bill and Melinda Gates Foundation, the Children's Investment Fund Foundation, and the Eleanor Crook Foundation, which was in their May 2024 publication, which they titled Healthier Pregnancies and Brighter Futures for Mothers and Babies, a Global Investment Roadmap for Multiple Micronutrient Supplementation. The guidance document complements the framework by explaining the rationale behind using implementation science, the essential components of implementation science, and how implementation science can be applied across the pillars and phases defined in the framework. Today, we are pleased to welcome two experts who really worked hard on, one of them worked really hard and led this initiative to develop these documents, Rebecca Heidkamp from the Johns Hopkins Bloomberg School of Public Health, and Julia Rotich from Kenya, and who leads the National Micronutrient Deficiency Prevention and Control Program at the Division of Nutrition and Dietetics, Ministry of Health in Kenya. Julia also coordinates the National Micronutrient Technical Working Group, which is responsible for formulating and reviewing policy statements, guidelines, strategies, and nutrition work plans, and also developing training manuals and capacity development documents at national and subnational level, which are key to knowledge sharing amongst the program implementers, but also government staff. Also, in the audience, we are going to be joined by Shannon King and others who worked on these resources, who will be joining us during the panel discussion to help with discussions. At this stage, I want to thank all the people who contributed to the development of these guidance documents. There were over 25 experts from around the world, a lot of reviewers from countries in Africa and Asia who are going to be using these documents on a day-to-day. And therefore, we don't have time for me to mention all the names, but I hope you feel that. In terms of housekeeping, when you're about to speak, or if you want to speak, feel free to introduce yourself by turning on your video. But for now, introduce yourself by stating your name and organization and country in the chat. You can also write your name and affiliation in your Zoom window and turn on your video when you're speaking. All participants will be muted during the presentation, but you can be able to unmute yourselves during the Q&A. You are welcome to use the chat box to ask questions. And in case you have technical difficulties, just reach out to our tech support. The resources are, as I mentioned, in the chat. And so you will be able to interact with them by downloading them or opening them online. At this stage, I want to hand over to Rebecca to introduce these resources, and rather we have a quick conversation with Rebecca about these resources. Rebecca, welcome to the chat.
Great, thank you so much, Martin. It struck me as I was watching that from the start of this process of developing these documents, it's been about a little over 9 months, so a little bit over the duration of a healthy pregnancy that we've been working hard as a group. And so it's really exciting to be able to introduce these documents and to get them into the hands of the people that we really hope they'll be serving. So just to say, why did we do this? Why did we develop these? Well, as everyone on this call, I'm sure, is aware, WHO released a recommendation in 2020 that countries adopt multiple micronutrient supplements during pregnancy within the context of rigorous research. And that includes implementation research that examines the acceptability, the feasibility, the equity, and cost effectiveness of MMN implementation. So the relief of these guidelines really put MMS on the radar of national governments. And they know that they're a well-researched, used, established nutrition intervention that can improve maternal health and reduce adverse outcomes. And we've seen the momentum. Today there's at least 23 countries are currently introducing or exploring the introduction of MMS, with more countries expected to join. So we know that, getting this intervention into the hands of women is more urgent than ever. But we also know from the experience of implementing IFA and other interventions that there are challenges. So what is it that we can do? Well, with the support of Kirk Humanitarian and other donors, the MMS Global Tag hosted by Healthy Mothers, Healthy Babies, commissioned 2 resources that can offer some really practical guidance about pursuing the introduction and scale up of MMS within a strengthened ANC system. Next slide, please. So the first document I'd like to highlight, as Martin's already introduced, is an FAQ, or a frequently asked question resource developed for national decision makers who are considering the introduction and scale up of MMS programming in their country. And we know that these decision makers, especially as well as those who are advocating or those who are advising those decision makers, are encouraged to use this FAQ as a resource as they themselves consider whether and how to scale up MMS, but also as they try to communicate with others the potential of MMS and as they build that momentum and buy-in. The document addresses some of the most frequently asked questions that the MMS tag and others who are involved in the space have heard about how to introduce and scale MMS delivery. That includes why introduce Unimet MMS, what is the pathway for introducing and scaling MMS programming, and what is this WHO policy guidance and how should it be interpreted? So this FAQ is available in English, and it will soon be available in several other languages, including French, Spanish, Arabic, and Portuguese. So hopefully being able to maximize its reach. Next. The second resource, and this is the one that I've been much more involved in and feel I'm very excited about, is guidance for using implementation science to support MMS programming at country level. So this is intended for practitioners and some of perhaps the researchers that they might be partnering with who want to understand how implementation science can support efforts to introduce and scale MMS programming. These people can include the national or subnational MMS technical groups or task force, government, implementing partners, research. There's a wide range of people that we want to see engaged in implementation science for MMS. It's really important to note that this is not a recipe. This is not a step-by-step instructions for how to scale MMS. Instead, it provides guidance about how implementation science can be used to support different stages of introduction. and also help meet that WHO recommendation about doing this in the context of rigorous research. And one of my favorite things about this document is it includes some really rich examples from countries that have already been walking this path, and I think provides a really wonderful opportunity for us all to learn from them. Next slide. So, speaking on behalf of the authors of these documents, and especially the IS document, we believe that an implementation science approach will contribute to better outcomes in women and children for maternal micronutrient supplementation, but also for any evidence-based intervention, because it helps us address context-specific barriers using evidence-based approaches. So IS can help answer really important questions like some of those listed on this slide. So I'm really excited to see as these goes out. I'm really excited to hear back from some of you as you explore and use these resources. But for now, I'm going to hand it back over to Martin. Thanks.
Thank you very much, Rebecca. Perhaps before you jump off, one question or two, could you perhaps mention what are the key features of these implementation science resources?
Yeah, so some of the key features of the implementation science resources, a first part of it is just introducing the concept of implementation science. And one thing that I find really important about that is sometimes we take a really narrow view of implementation science and we think it's about collecting new information. But this document really emphasizes the importance of using and contextualizing existing evidence as being part of implementation science. So after it establishes that, it really steps in and helps people understand, well, what are the questions that we might need to answer at different stages in the introduction process, and shows, examples of how others have perhaps answered some of those questions. And then another part of it is just a really practical kind of how-to, is as you go about implementation research, what are the pieces that you need to be doing, and how do you look and find the resources and that can help support you at each step of that process.
I like that. And on that last part of how to, so who is meant to use these documents and when?
Yeah, so I mean, this document, I would say, is really for anyone who is interested in making sure that implementation science gets used. I would say it is for the person who's maybe one step more involved in the process of implementation science than maybe some of your highest level advocates. But I will say that even as a researcher, I find this document to be really useful to kind of bring me back to the heart of what is important and how do we make implementation science, it's meant to be a really practical, contextual applied. So I really feel like anyone ranging from someone with more of a programmatic background, even to those of us who think of ourselves as researchers, can really benefit from this document.
Thank you. That sounds very good. Yesterday I had a nice conversation with a colleague in West Africa, in Nigeria, actually, who mentioned that she could actually also use the documents for other aspects, not only MMS. So that will be interesting to discuss later in the panel discussion. For now, I want to first welcome Julia to give her opening remarks. And then I'll pose one or two questions to her, and then we can discuss in plenary, if you will. Julia, over to you.
Thank you so much, Martin. Hi, everyone. I'm really delighted to be in this meeting, and I just wish to give you a brief on the Kenya situation regarding the multiple micronutrient supplementation. I was going through the documents that were shared, and I noted that we have a world map of the multiple micronutrient supplementation activities, and various countries have been placed in different categories. Like in Kenya, we are placed in the category of information on MMS available. But in this case, there is still no active implementation. So I would also wish to mention to the team that we already have established, as Dr. Martin has mentioned, we have already established an MMS task force, and it has members from various agencies and organizations. We have partners, we have the key stakeholders whom we work together, of course, with the other Ministry of Health divisions. And our basis is actually on the WHO guidelines, and through the guidance development group, commonly known as the GDG's opinion, option on recommending MMS under certain conditions. We have actually borrowed that because it gives that this MMS can be adopted or adapted under rigorous research. So that means then in our task force, the members actually propose that we need to have that rigorous research. We need to have that research so that as we carry out the interventions, it will be based on some data, especially within the Kenyan context. So at the moment, we are actually at the exploration phase, and we are planning to carry out an implementation research so that the results that come out will actually be very useful in passing to the higher levels for decision making. Next. So we have a recent survey that was done in 2022, and it shows that use of the iron-containing supplements in the recent pregnancy by the women who were interviewed that time indicated that 9 in 10 women, pregnant women, were able to were issued actually with the iron-containing supplements. And we also had another assessment last year, and we had sampled 4 counties with varied geographical distributions. And we also noted that there was an increase actually in the adherence. That means those who were able to consume the IFAS that they were given came up actually to about 67%. In this case, then we saw that there were various recommendations that were done. There were certain barriers, there were certain strengths that were obtained from the respondents. And all in all, there were those factors that were relating to the client and also those ones that were actually relating to the health system. So we are actually delighted to have this session so that you can have a global view or even the regional view on how we can be able to address issues that come up in IFAS, and this also could be replicated in the MMS. So that is it that I have for now, because I long to have a sharing experience, which probably could be adapted in our situation. Over to you, Martin. Thank you.
Thank you very much, Julia. You know, you mentioned really important information. First, that almost all countries currently have iron and folic acid in one form or the other, and they are considering how do we transition to multiple micronutrient supplements. And as you have correctly stated, you have discovered in Kenya, after doing your research, contextual research, that there are some questions that need to be answered. I'm happy to see that your adherence rates in some counties, I think you've mentioned there are only 4 counties. I know you have 47 counties, so I know you have a lot of work to still check in all the other counties. And you seem to be having some better results in these 4 counties. But earlier on, we were talking with you and you mentioned that adherence has been an issue. So I would like you to reflect on, as you plan the pilot studies that you have mentioned the task force is working on, do you think these documents that are being released today will be useful, and how?
Yeah, thank you so much, Martin. As Rebecca mentioned, this document actually provides guidance. It's not prescriptive. It's not a recipe, as actually she put it, but there are some important issues that we will actually apply basing in our context. So yes, it will actually be very useful because we can also use it in various sectors. It's cross-cutting. It will also give us guidance, especially on issues relating to policy development, maybe guidelines, development as well, and any other related guidance towards adoption of an intervention. In this document as well, there's something on financing, and therefore the funding issue will be addressed so that we can see how the country can also make some budgetary allocation. In our country, we have counties. I can say they are sovereign. And at the moment, every county is responsible in procuring their own iron and folic acid supplements for their population. So that means there has to be some budgetary allocation for that. And therefore, this document will be quite resourceful in, setting aside some funds for this essential commodity. The other thing is about the product quality. I think the guidance given there can be a good pointer, especially in terms of the kind of the commodities that are going to be used, maybe the formulation, and also the delivery channels as well, for each and every phase, because we have the phases that we are in. Like in Kenya, we are in the exploration phase. So what would we need in terms of the supply chain? What would we need in terms of carrying out the implementation research? So I think commencing the implementation research would really be a bit, guided, because we already have this implementation science guidance, and therefore we shall base our guidance on that.
Thank you so much. And I think you have correctly stated it that your office provides guidance not only to the to the program that you are responsible for from your office, but also to 47 other governments, if you will, which collectively make up Kenya. So if you have 47 people knocking your office to ask you, what should I do, or how should I conduct the pilot study to check whether MMS is suitable for my people, I think you will now have a resource material. At this stage, I want to thank you for, and I will also channel some questions to you a little bit later. For now, I want to bring, I hope if tech can allow me to bring on Shannon, perhaps, and Rebecca as well, so that we can have a discussion generally about, I want to take it back to WHO, because that's where Rebecca told us it all started, the guidance from WHO. Shannon, let me start with you. Perhaps could you introduce yourself, just name and your role and where you work, and then go on to tell us from the guidance from WHO, what did WHO call for, and have these documents, do you think they have responded to that call by WHO? And can they, if countries use them, will they be able to meet the requirements by WHO? Over to you, Shannon.
Absolutely. You're giving me a tricky question of, are we meeting WHO's guidelines or not? Yeah, so as Martin mentioned, my name's Shannon King. I work with Vitamin Angels as a technical lead for one of our large projects. And within VA, I work on a lot of our implementation science projects. So in terms of WHO's guidance for MMS, as was briefly mentioned by Rebecca and Martin, in 2020, they provided the recommendation that MMS could be explored for introduction in pregnancy within the context of rigorous research. So what that rigorous research means was a few different things. There was a call for some more research around the effectiveness and efficacy, which many people have looked into, and HMHB has provided a lot of resources around. But there's also been a large call for implementation research. So thinking about how, if countries are going to explore the introduction of MMS, can it be done to address the existing challenges with IFA, whether that be coverage of IFA or adherence to IFA? So we're really hoping that by providing resources to countries to do rigorous implementation research, and we've defined that throughout the document of being well-formulated research questions, using theories and frameworks to guide the work, as well as study designs, that countries can help to generate the evidence around how we can implement MMS to ensure that women are accessing it and taking it, and hopefully resolve some of the challenges that countries are currently having with regards to their IFA programs.
Very well put. Thank you so much. We'll turn to Rebecca now. Rebecca, I know you are an implementation science expert. Some people also call it implementation research. We will not go to the differences of that for now because of time. I also know that you are involved with the Society for Implementation Science in Nutrition, which I understand has now moved to the Micronutrient Forum. So I wanted you to start there and help us break down implementation science, because a lot of country actors, Julia's colleagues, when I talk to them, they tell me, why are you telling us to do research? We are not researchers. But then why is implementation science so important? Could you bring it home for us?
Yeah, so I know that term research is really intimidating. And actually, it can cause, sometimes when you bring it up to certain people, it can actually cause them to push back. It's like, we don't need research, we need action. We need to make this happen. And that is the heart and soul of implementation science. It is about how do we bring, everybody wants to do evidence-based practice. So this is the, how do we bring evidence to tell us how to make this happen? So I wouldn't think about it maybe as much as research as it's about generating evidence that allows us to do evidence-based and effective implementation, which I think is something that everybody agrees on.
Nice. I think Julia will be happy to hear that, because I was a bit of a fly on the wall in one of their meetings, and one thing that I heard very strongly is that they needed to understand their local context, and they understood that this implementation research, implementation science will help them understand how not only to roll out MMS, but also how to not repeat or rather to overcome the challenges that IFA went through. So that is really helpful. Julia, if I come back to you, you mentioned that you work with a lot of partners. At one point, you even told me you have over 30 partners. So how do you then, in this document, how do you bring it to the partners, or rather, how does it work? Could you reflect on that? Perhaps maybe others in the room, now we will go to the general, to everybody else in the coffee and chai chat and find out whether people have your experiences. Talk to us about how you work with your partners and how these documents might be brought to them.
Thank you so much, Martin. Yes, when you distribute these partners, actually they're not as many as you're putting it, but they have roles at different levels. Like at the national level, we have the development partners who actually are very key in provision of even technical assistance and funding, especially like when we have meetings, we're developing documents. That is where they really are coming. We also have others that actually are implementing at the county level. We have those who are really based, as you know, Kenya is devolved, it has counties. So we have those ones who are supporting counties in terms of putting into practice the way Rebecca said. It's really like, can you bringing out the practicality of it at the county level. And then of course, we also have various categories, even in the health system strengthening. We have various partners also who play a key role there. And even in comes to developing, coming up with the documents, as I said. So we have the development partners, we have the implementing partners, we have those who provide funding, among others. So when you distribute them, you see that we have those who also are more focused in the more arid areas. In Kenya, we have regions that have issues on food and nutrition security. We have those also who are focused in more arable lands. There are those who are actually in dealing with coming up with the boreholes or biofortification procedures, like coming up with foods that have been fortified. So when you look at it, finally you see the distribution is so wide, and even the population of Kenya is also so big, such that the impact is not so great. And therefore, we would really wish you can have something more sustainable, where once you have the evidence, then you can all work together towards embracing an approach that will be more sustainable, cost-effective, and can be able to improve the nutritional situation and the health situation of the population, especially the vulnerable groups. Now we are talking of the pregnant women. And even anemia also is coming up among the preschool children, that is 6 to 59 months. So all these geared towards coming up with a more sustainable approach that can be able to improve the nutrition situation of the Kenyan population, especially the pregnant women.
And that's the reason why your office is so important and critical, because it's a national, if you have a national agenda, then you can, at scale, you can reach more women. I think that's a really well taken message. I want to remind the audience, our visitors today, that you can ask a question in the chat, and we will try as much as possible to address your question. You can ask any of the panelists. For now, I have a first question from Miranda to Rebecca. The question is, has there been a country that has successfully transitioned from IFA to MMS and effectively used the evidence generated to inform policy change? Rebecca, do you feel sufficiently informed to respond?
Well, I can say that there is, I would say everyone is on a journey right now, countries. I don't think we have any country that feels like it has reached the finish line of a full transition. But, our guidance really does highlight a few countries that are a little further along. And I'm going to punt this over to Shannon, because she's been involved, I know, with some of those countries that are a bit further along in using evidence. And I'm just looking at some of the names of others who are on this call. I know some of the people who have been most involved are also participating, so would love to hear from them as well. But Shannon, go ahead.
Yeah, I can take a quick stab at answering this. And again, just wanted to recognize that many of the people who have pushed this forward are on the call. So our colleagues from Indonesia, I would say, are one of the countries that's furthest along. They do actually have an official MOH decree to implement MMS in country as the standard of care for MMS. And very soon they'll be launching it. So I know we have some colleagues from the University of Indonesia, Vitamin Angels Indonesia, and many of our other local partners who have really been instrumental in that journey that started way back in about 2018. So they are definitely a country that is very close to launching this nationally. And I'm sure would be pleased to share any of their learnings at any point. And we're very excited to see that official launch coming soon.
That's wonderful news. I think considering the population size of Indonesia, that's a major win for women's nutrition and for maternal nutrition. Those are the kind of news that make me go to bed very happy. So Shannon, staying with you still, there's a question for you. For how long implementation research, especially where countries have documented better coverage and adherence to MMS compared to IFA, what's the cutoff to complete the policy shift from IFAS to MMS? I suppose I don't know whether I'm paraphrasing the wrong way, but somebody's asking, how long can you do implementation science? Did I get it correctly? And but before you answer, just to remind the audience that you are also allowed to, put on your video and pose your question by yourself, if you can. Over to you, Shannon.
Yeah, that's a great but difficult question about the timing. So I think one thing that you'll see in the guidance document is that we've acknowledged that as more countries go through this process, the time that's needed in terms of generating new evidence will probably shorten. So Rebecca spoke before about how implementation science is not just creating new evidence, but also using evidence that's been generated in other contexts. So really, we don't need every country to be doing a 5 or 6 year research study. As we get more global evidence around what's working, we can use that global evidence and that relates to your context and inform this. In terms of the timing, I think that is very country dependent. At the end of the day, in all the countries that I've had the pleasure of working with on this type of work, what is needed to make that policy shift is really dependent on the local government. So what do they need in terms of evidence and recommendation to be able to move forward with the policy shift? What is the process for doing that? So timing wise, it really depends on what are the research questions of the country and what do they feel like they need to understand to be able to make this policy change. So yeah, I think it'll depend on the country, but we're hoping as more countries do it, the time will shorten.
Can I add something there too? Because I hear this question of like, when does the implementation science end? And I think what this document will show you is that there are different questions to ask at different stages of implementation. And I think, this example of 20 years down the road, we might have MMS, out there, but things change. I think the classic example in nutrition is thinking about high-dose vitamin A supplementation, right? And we piggyback that on, in many countries, polio. And now we see polio, our implementation platform is changing. And so we have to rethink, how is it that we're going to deliver vitamin A to children, for example? And so it could be 20 years from now that we have a very different set of questions because the context is changing. But that's the exciting thing about implementation research. It's about what is the barrier right now, and how do we generate evidence that helps us at the stage we're in? So I'd like to say you should never stop doing implementation research, but it's with a very different purpose, and it's all about solving very practical challenges that are facing you at different stages.
Well put. I'm going to go back to the floor now and take 4 questions, and then my panelists can help prepare as the questions are being posed. So first I will recognize Ekpenyong Efiok. You can ask your question. After that, Cynthia, ask your question, then followed by Samson, then followed by Keith West. When you're asking your question, feel free to unmute yourself and also put on your video if possible. Otherwise, if your video is not possible, just unmute yourself. We'll still hear you. Ekpenyong, over to you.
Okay. Good afternoon, Mr. Martins and everyone on board. My name is Mr. Ekpenyong Efiok from Nigeria. I work with Every Infant Matters. Every Infant I hope you know Every Infant Matters Association in New Delhi, run by Dr. Radhika and Dr. Shirley Batra.
Please
so
proceed,
we partnered.
Proceed to your question very briefly so that we take the 4 questions.
Okay.
And we save some time.
My question is not really a question. I want to say, with the little experience of implementing MMS in Nigeria, we can see a lot of improvement, a lot. And we can never stop because nutrition is a problem in Nigeria right now, most especially in the northern states. So we can't stop right now because I've seen, I worked in the field, I worked with Vitamin Angels, the partners who are based in Abuja, supplements, the prenatal supplements we're doing to the pregnant women. A lot of testimonies. You saw a woman who used it when she was pregnant, the second child, the third child. She could tell you the differences in the sizes of the baby, in the healthiness of the baby, and the weight of the baby. So we can't stop. So to me, I would say the implementation stage of MMS should continue in Nigeria for now. We can't stop. But my question now is, we have the local partners who are on ground, the field partners who are on ground, trying to make sure this implementation goes on. We are being obstructed tremendously because of the bureaucracy of the government, bureaucracy of the leaders who are in charge of the health sector. They keep bringing on a lot of bottlenecks, making it difficult for us to reach even the more hard to reach stages of these communities here in Africa. You can understand what I'm saying when we talk about Africa. The riverine areas, areas where there are no roads, areas where there are no access to those people. So what can we do? Because we as local partners are having challenges getting funding. And I know Vitamin Angels will not give funding. I know other partners will not give funding. And we are made to understand the government of the day are supposed to work with us to be able to achieve this implementation. But they don't.
So that we can take the next question. I think your question is well noted.
Thank you very much. Thank you.
I will ask my panelists to reflect and see who can answer it. Perhaps Julia, speaking from where she sits as government, can reflect on why national governments find it so difficult to have a cross-cutting response to, or these kind of questions. As they're preparing, I will invite Cynthia's hand was up, but it's now down. I don't know if Cynthia still wants to.
Hi, Martin. Yes, no, my hand is still up. I just lowered it because you had recognized me already.
Please keep your question very short and to the point.
Okay, perfect. Thank you. My name is Cynthia from CHAI, that is Clinton Health Access Initiative, Uganda. We have been supporting the ministry to implement, and we are going into the implementation stage of our research next year, January to June. So I was just wondering, I think the constant question that is coming along as we implement is the cost of MMS versus IFA. How are we going to be able to, what is being done to kind of support to reduce the price for MMS, so that, because in Uganda all systems are go, everybody is on board. So how are we going to maintain this momentum and be able to afford MMS as we start the national rollout?
Thank you.
Thank you very much. Cynthia, I will request perhaps Shannon to prepare with a response to that question. Then recognizing who was the other person? Before Keith West, there was somebody else. I'm forgetting the name. Keith, do you want to proceed with your question?
Sure, it's just a quick comment. There was a question about countries that are scaling up based on their research. And another example is in the Middle East with the UNHCR, UNRWA is carried out a very nice implementation research trial or systems trial, which is now in the process of being published and using that information to scale up. But 2 quick points. One is just to point out table 2 in this report that Shannon and Rebecca and other authors have put together. You'll see that these are all implementation related outcomes. They are not randomized controlled trial outcomes on health impact because the health impact has been demonstrated for MMS. So in looking at this report, that is the most important 2 pages in the report because it steers you to the kinds of outcomes that need to be measured in implementation research.
I feel like it's distracting. Yeah, like it's like, okay, commit.
Sorry, maybe you can mute.
The other point is on sustainability. Rebecca mentioned that the research continues. The only way to measure sustainability is to allow the program to sustain and to give it time. And that takes years. And things can go wrong, and to document those things that go wrong and right along the way. So that's the longest term outcome that you have to really deal with. I'll stop there. Right. Thank you.
Thank you very much, Keith. Rebecca, perhaps you can reflect, especially on Keith's comments. I'm curious what your reflection would be. And I will take the last question, and then we can go to the answers. Dr. Osita Okonkwo, do you want to keep your question very short and to the point, and then we can provide some answers?
Yeah, I just thank you very much. It's been a very educative meeting, and I'd like to also state that a lot of work is happening in Nigeria on MMS transitioning, and Nutrient International is leading on that. I also informed that just like someone had mentioned earlier, the issues around government coming into the space. In Nigeria, the government of Nigeria is leading, and they are leading to ensure that evidence are generated, to help the transitioning process. We are conducting a research currently that is informing that process for Nigeria, where we are working on developing adherence solutions that will ensure a seamless transitioning from IF8 MMS. Probably that's one reason why the last speaker who mentioned that they're not having enough government support and not be supported, because government want to be sure that the errors that were made in IFA, and of course, there are a couple of issues that will have to be dealt with. MMS is not for treatment, so it's actually for prevention. So people need to be trained and be well equipped on the information they need to know, especially for the care providers at the health facilities, and also to ensure that the community are mobilized to be able to be involved in ensuring that women who have access to MMS utilize them effectively. And also, not only for that, to ensure that they come early enough to make the benefit of use of the supplement. So these are what is going on in Nigeria, and we are also helping the government to situate that in their policy of government. Right now, there is the ongoing discussion at the National Assembly to introduce MMS into the policies to ensure that every government makes it compulsory as a minimum package for every pregnant woman. This has to happen, and that's an area we are also focused on. Thank you.
Thank you very much for responding to that. I think you have also helped Julia answer the question I had directed to her. So Julia, you can breathe easier. Samson, I had forgotten your name, but I had recognized your hand. So I will let you ask the question, and then we can quickly get the answers from the panelists. Keep your question very brief and to the point.
Thank you very much. And yeah, indeed, my name is easy to forget. Samson, I'm the Nutrition Program Manager for UNICEF Rwanda, and supporting the Rwandan government effort in introducing and scaling up MMS. So what I want to highlight is the fact that on one hand, we have enough global on the benefit of MMS, and countries are not going to generate that kind of evidence which come from clinical trials or others in an implementation research, and that is clear, and thank you very much for further clarity. But when we talk about implementation research, we are basically talking about whether MMS is suitable for mothers in our country context compared to IFAS, whether there is better compliance, adherence, and coverage, and these kinds of programmatic or operational evidence or indicators are things that we want to know. So in a circumstance where, let's say, a significant implementation research in comparison with areas of IFAS generate an evidence with better coverage as well as better adherence or compliance by the mothers. And then there is an enabling environment, positive enabling environment with additional qualitative evidences on why MMS is preferred or taken up by mothers. I don't think that these two recommendations of humanitarian setting and implementation research should hold back countries from scaling up MMS and replace IFAS with MMS. And we all need also to realize or admit the fact that MMS is one additional product into the broader maternal nutrition program or perspective. And we need to look at how best we can integrate MMS into existing maternal nutrition program framework or antenatal care guidance. And somebody mentioned earlier, as the program matures and progresses, of course, platform and delivery could change the way polio or vitamin A changed, but that doesn't warrant to keep the program in limited geographic area as an operational research or waiting for humanitarian crisis to deliver the program. The program can be delivered, scaled up, and we can continue learning what is the best delivery channel, the best platform, the best program to integrate MMS in existing healthcare service delivery, not to run MMS by itself as a vertical program across the board. Thank you very much.
Interesting comments. Thank you very much, Samson. So now we'll go back to the panel, my panelists, and you have heard the questions. I think Julia's question was slightly answered, but I would still want her to take just 1 minute, reminding you that we have very little remaining time. So keep your responses also short. The way we do this is we start with Julia, who responds to the national government questions and how how you are seeing it from the Kenyan side. I think for the Nigerian side that was reflected on. Then we go to Shannon, and you can handle the questions that are directed to you. Then Rebecca, perhaps you can bring it home, and then we can proceed to closing from there. And reminding the audience that keep adding questions to the chat. All the questions will be taken and will be answered, and we can we have your email addresses. We can always send you the answers even after this call. So now we go to Julia for your reflections. You are muted, Julia, if you could unmute.
Okay, sorry for that. So thank you so much. I think it's really exciting to have views from different countries, especially regarding the MMS introduction and scale up. And we all go through various phases. But you can see whatever we have gone through in IFAS supplementation will just be more or less the same, because at the end of it all, we would like to have a more sustainable process, something that would be owned by the country and really adopted very well by the population. So we are looking at the cost effectiveness, the benefits that come along with a product. Like for IFAS, I saw in a publication by Gomez, really that IFAS and MMS address anemia. But when you look at the other benefits, I think it's an area that we were discussing in a meeting that we had, that it would also be very good to do more researches, even after delivery, so that you can follow up on if there were any benefits from the MMS supplementation, even throughout up to 2 years of aging of the child, or even beyond. So we would like to track impact, especially because it's new in our country, and probably have something to say about it over time. So we are looking at the cost effectiveness, the sustainability, the availability of the commodity, because in one of the counties where we did IFAS assessment, we had stockouts, and it really affects, cases, especially the maternal outcome, and even the infant as well. So we need to have a holistic approach towards introducing a new product to ensure that once done and its benefits have been determined, then we do not have stockouts, because that will mean an additional cost from the women, maybe going to the chemists. Some even do not buy. In most cases, they would even not buy at all, and they would leave hoping that they will get in the next visit. So the issue of the supply chain also comes in very well. And the community acceptability. In our country, we have a strong community health system now, and it is being strengthened, and we have an e-system. It's called ECHIS, electronic community health information system, where data concerning a woman who has been identified as pregnant is uploaded and followed up immediately. So this is a system that we really are banking on, hoping that it's going to introduce women to the right supplementation early, proper nutrition, and thereafter, even for the child, as they grow, they can be able to be monitored to ensure that they are in good nutrition and health situation.
Thank you. Thank you very much. Thank you, Julia, for those wonderful comments. I will be keen personally to hear about ICIS going forward in the coming years. Shannon, over to you.
Yeah, I'll keep it very brief. But in terms of the cost of MMS and IFA and how those relate, there is a lot of work happening on the global level about supply of MMS and ensuring that there is enough supply produced globally that we can transition fully. As well as part of those efforts is bringing down the cost of MMS to being on par with IFA. So I know there has previously been a coffee and chai chat with Dr. Clayton Agello and Martin talking about the supply, and I'm sure he dives into cost. But would just say that you'll see within this guidance, supply and product is one of the pillars that we really emphasize needs to be explored at the same time as all those other delivery questions. So just encourage you for looking at supply this early on in the process, and there's a lot going on that we can point you to other resources around getting a stable and accessible supply.
Thank you so much. Rebecca,
so I think Keith really captured that the importance of implementation research, what makes it different is that it's focused on implementation outcomes. So it's these questions of how do we deliver effective counseling? How do we reduce the barriers to adherence? How do we train and supervise our people? Those are the really practical questions that we're answering. And, it's different from methods. So you can do an RCT looking at different ways of training people compared to the usual way, right? So it's a question of implementation outcomes is what our focus is on. And, as I was listening to people, I think maybe one thing that I was reflecting on is one of the values of taking this kind of implementation and doing rigorous implementation research and implementation science is that if we follow these ways, we can start sharing evidence with one another. And a key thing about implementation research is that it's contextualized, but there's also value in learning from others. So I think about it kind of like raising a child, right? You need to contextualize your parenting to that child, but you still ask your aunties and your sisters and your brothers about how have they raised their child, right? And I really think that that is maybe the heart of what we're talking about. It's about generating lessons that help us, but then also can help others as we face many of the same challenges.
On that last part of talking to others about how to raise a child, it's a very nice place to bring this conversation to almost a close. In the next couple of days, about 14 days from now, if not less, we'll be convening in Africa a meeting of about 17 African governments, again, to discuss MMS. And some of the questions which are coming in the chat, for example, about quality of MMS, for instance, government delegations will discuss that and also have an opportunity to talk, for example, with the UNICEF Supply Division to understand how does the UNICEF Supply Division ensure that any product given to pregnant women is of high quality and that is maintained over time, including how certification is done, for instance. So this will be a very interesting conversation. And any findings or any information coming out of that meeting, we'll be sure in the future to also bring to this meeting. So I want to take this opportunity to thank our panelists. Julia, thank you very much for making time. I know you are very busy. Shannon as well, and Rebecca making time as well. And the amount of work you did to get these documents done and getting all the reviewer comments worked in as well, amazing. So thank you so much. I think this is a major shot in the arm for maternal nutrition. Considering that these documents will not only be used for MMS, I think they will be used for many other interventions as well. I can almost see academics also using them in the classroom as well. So want to thank you immensely also for participating in this chat. To our audience, thank you for making time. Stay tuned to for our next chat. The recordings are available on our website. You can just go to HMHP Consortium/Coffee and Chai Chats, and you'll find all the the recordings there. If you'd like to join HMHB and also be contacted about future coffee and chai chats, you can also go to our website, and there's a link there. Also, I believe it will be put in the chat, and you can join us. Follow us on X and Twitter. Well, X is Twitter. Follow us on X and LinkedIn, and we'll be able to keep you informed. Also, share with you our newsletters. Thank you very much for today, and see you next time. Bye-bye.